Hello, everyone. I'm Christy Risk, Senior Editor at GenomeWeb, and I'll be your moderator today. The title of today's session is Powering Precision Medicine at Apollo Genetics. Our panelist today is Dr. Jason Walker, Clinical Lab Director of Apollo Genetics. Dr. Walker will be speaking about his experiences with building an end-to-end laboratory information management system and genetic variant analysis support tool. Special thanks to our sponsor, SunQuest. Dr. Walker, please go ahead.
Well, thank you for having me, and thank you again to GenomeWeb and SunQuest, our sponsors. I'm really going to take this as an opportunity to brag a little bit. I'm very proud of what we've been able to accomplish through our partnership with SunQuest. It's been a long haul. We have been together for 5 years, changing and growing. Believe it or not, 5 years is an eternity for a small startup laboratory like ourselves. As a short introduction, my name is Jason Walker. I am the Clinical Laboratory Director of Apollo Genetics in Baton Rouge. Our specialty is on germline molecular genetics. We provide pharmacogenetic testing as well as hereditary cancer to carrier screening as well as other opportunities. The main point of my talk today is to really give you a review of our process in developing our workflow from our very beginning up to the implementation of next generation sequencing and all the excitement and opportunities that come with advancements in technology. Our mandate at the very beginning was to establish a laboratory that was lean and could provide genetic testing to patients and physicians. We believed that the time had now come that molecular genetics was ripe to provide useful information to beyond the specific cancer genetics and treatments. Really, the average person could benefit from knowledge base, the technology, all had come to a sufficient level that it was feasible to provide this. And it was traditionally the purview of large hospitals, large institutions, medical schools, universities. But we thought that we could provide this service as a small, lean laboratory. I knew going into this that we could not depend upon the existing LIS and LIMS, laboratory management software. These systems that I had experience with were large, clunky. My son would describe them as steampunk, really just sort of outdated and probably worked very well for hospitals at the time, but to work with them in a molecular genetics workflow would be like sticking the square peg in a round hole. So really we wanted to look at something new, something that had the capabilities to grow and develop with our laboratory. Really the 21st century LIMS. We were not in 1999 anymore. We needed to look at paperless. We needed to make sure information and data in large quantities were able to move smoothly and seamlessly from one system to the next and maintain privacy and security throughout the process. And just to go into a little bit more detail about that process, this is the structure of a typical next-generation sequencing lab. On the left side, we have the wet bench, which is really sort of a standard laboratory operations. We were looking for an LIS that would provide us with everything we needed for tracking patient samples, document control, qualifying reagents and equipment, prompting for preventative maintenance, all of the compliance and standard laboratory operations tracking that the old LIS could provide, but designed specifically for molecular genetics, which in many ways is distinct from the traditional lab or clinical. On the right side is something entirely new. It's a second half to the analytical process, and it's known as the dry bench, or the dry lab in this case. And that involves the analysis of the huge amount of data that Next Generation produces in the wet bench process. And in this part of the analytical process, we need an enormous amount of support from technology. We are leveraging our current knowledge, the entire human knowledge, really, medical knowledge for interpretation of variants that we identify. We need to be current, we need to be accurate. The dry lab provides an extraordinary opportunity to take advantage of NGS technology. NGS is really just I like to think of it as millions of assays, and each one of those for the average patient comes out within reference. So when a patient gets a negative report, it looks very simple, but in actuality, it's saying that for every position in all of the genes we tested, you were within the reference acceptable range. Getting to that point requires an enormous amount of effort, computationally speaking. So the movement of large pieces of data from the wet bench to the dry lab seamlessly is important to speed up this process. This process can also be a huge bottleneck, as frequently we can produce large amounts of data during the wet bench process, and we just don't have the staffing necessary who can handle large quantities or a bolus of information moving through the dry lab. So it's important that we had a lot of support, flexibility, and the ability to respond quickly to dramatic increases in workflow as needed. But not to go into details, but the goal of this process is to filter down all of that information to what really needs attention from an individual, a PhD scientist, who will then use tools made available through the LIS to access public databases, literature, and to really scour what we know about that variant to provide the best, most current information available. And then finally, report delivery. And then at this end, we also need the ability, since we're not a hospital laboratory, we need to interact with a number of third-party partners, both at patient sample, at the acquisition portal requisition, all the way down to report delivery. So it was important that flexibility be built in, and like I said, 21st century interfaces. In summary, our general project goals were, of course, to meet our CAP accredited and CLIA certified compliance. The easiest way to provide quality data and reports is to stay compliant, and we seek to do that on a regular basis. We are very proud of our CAP accreditation. HIPAA compliance, of course, is of primary import. But for me personally, I was most interested in finding a LIMS that could provide flexibility. The technology is changing so rapidly. The menus are changing so rapidly. The knowledge base is changing so rapidly. The LAS can't afford to assemble a committee and then wait for an IT ticket to go through to rearrange a panel for you. It's something you need to be able to do almost in real time. Process tracking and resource management, of course, the core needs of a laboratory information system are easily satisfied in Sunquest's options. Right now we're using Sunquest Mitogen. This is the latest iteration, and it's been has met all of these needs that we are currently discussing. The genetic data interpretation and management is, of course, my favorite part. To be honest, I was a bench scientist all my life, and I always gave side eye to those guys over in the bioinformatics lab. Thought they were a little weird, but once I've gotten into it, this is really, truly my favorite part, the opportunity to see where we stand as a human race on our scientific knowledge and then apply that directly to an individual's personal outcomes, personal mental outcomes is really thrilling. I digress. In summary, what were the results of this project? Again, our goal was to bring promise of personal genetics to bear. And this involved and was necessarily required a LIMS that could serve as the skeleton of this whole workflow. And here below, we've divided into two parts. The dry bench work, which focuses on workflow quality, compliance, tracking and audits. Got instrument connectivity, HL7, movement between systems, really a seamless automated operation that can be manually used as necessary to accommodate low workflow, or as workflow increases, we can look at more automated processes. Very responsive. On the dry bench side, we really needed connectivity with current databases and tools. Those needed to be made easily accessible in one location, so you can sit at a computer and process a number of variants of uncertain significance very quickly. All the tools you need made available through our LIS really helps us to overcome this potential bottleneck. More importantly, I think, is our participation with a Broad Institute initiative that is supported by SunQuest called Variant Wire. Participants are numerous and across the northern United States, well, the continent actually. And we all share our variant interpretations. And so this assists in quality control and helps to provide consistency between labs. It's an extraordinary tool regularly and are proud to be participants of. So I wanted to very quickly here at the end try and quantify some of the benefits and impacts of a truly well-developed LIMS system to support a modern molecular genetics workflow. Time savings, of course, go without saying. I can't really build this workflow without the LIS. As I mentioned earlier, it is the skeleton. Accuracy and consistency, of course, are assured through easy quality control and quality assurance. This leads, of course, into compliance, maintaining the highest standards for quality control and really making sure we produce a quality product. This is genetics. The patients are not likely to be tested again. We have to get it right. But there are amazing tools available in NGS, and the precision and accuracy we've been able to achieve is extraordinary and I would even say unprecedented. The knowledge resources available through the dry bench have been exceptional. Access to public databases, cancer databases, and available scientific literature. Annotation capabilities, the ability to reference and really customize a report for those patients who unfortunately have a pathogenic variant. We're able to really make it an individual report for that person and their particular. Organizationally, I sort of put this one in there because the ability to monitor your inventory, your document control, all of that now is very easy to do using modern electronic cloud storage, et cetera, which is quite well is very well implemented by the SunQuest Mitogen program. Now, the last one I have to throw in, because I am an academic, was research and development dexterity. We all have to, in these laboratory-developed test labs, perform a decent amount of research and development as well as validations. And to be able to coordinate these and use your existing workflow via the LIS is a nice perk from my perspective. We don't have to go off book and actually move our research and development processes through the LIS and make adjustments as needed. I thank you very much for this opportunity to talk about our efforts with SunQuest to really bring personalized genetics to everyone. I'd like to field a couple of questions at this point. The first one, I believe, we have today is, how would you describe the core value delivered through the SunQuest Mitogen LIMS in the wet lab? This is pretty easy for me. This can be summed up in one word: compliance. As I mentioned earlier, staying compliant is the easiest way to ensure that you provide quality care. And that is our primary goal, Apollo Labs. And the SunQuest Mitogen LIMS makes it easy as pie. So that's not something I have to worry about when I go to sleep at night. And the next question, I believe, regards the dry lab. How would you describe the core value delivered to the SunQuest Mitogen genetics in the dry lab? And as I mentioned earlier, this is my favorite part. I thoroughly enjoy having the tools made readily available, algorithms, et cetera, et cetera. The annotation capabilities are infinitely flexible and really allow us to take advantage of the most recent information and to keep our patients updated. I might point out at this point, I've got a little personal anecdote. Last week, my family actually has a VUS that I've identified. Last week, we were able to reassess it and classify it as benign. So I've had a personal impact from the Sunquest Mitogen program, which allowed a very facile update using new knowledge and information that sort of set some of my family at ease. Hopefully, we'll be able to carry that forward to our patients, and I fully expect to. Got another question here. How has installation of these technologies transformed your business? As I mentioned earlier, this is the skeleton of our company. It's hard to say how these technologies have transformed because they are, in essence, an essential part of our business. And to be honest, I see that as the future and actually the present. This is, like I said, the 21st century. I abhor seeing piles of paper and requisitions and shredding. I'd like to see all of that go away to help, number one, reduce pre-analytical errors, which are frequent, as we all know. But electronic interfaces can really help us to get that sort of error rate down. Well, that looks like all the questions today. Thank you very much for your time. GenomeWeb, Sunquest, this has been a real treat, and I look forward to more opportunities to speak with you and more GenomeWeb productions. Thank you.
Great. Thank you, Jason. We'll wrap it up there. We'd like to thank our panelists, Jason Walker, and our sponsor, Sunquest. Thank you all very much for joining us for this session.